I can start. My name is Ellen Pressman. I am the manager of the brokerage team here at Tandem HR. I have about 8 years of employee benefits experience working with clients as small as 2 employees all the way up to several thousand employees in all different industries, specifically manufacturing, healthcare, and food and beverage. James, do you want to go next?
Absolutely. James McCoy, VP of Brokerage, working here at Tandem for a bit over a year. I've been in the industry for a little over 2 decades, almost 2.5. Here, the team really works to support our client base for all their open enrollment needs, benefit needs. And I like to feel we're doing a pretty good job of that. So hopefully we can give some insights today. Jack?
My name is Jack Mangan. I'm a senior account consultant, also with the brokerage team here at Tandem HR. I've been at Tandem a little bit over 2 years, but I've been in the employee benefits industry for coming up on 8 years now as well.
Awesome. Thank you all. Today, we're going to be covering items that you need to be aware of when you're conducting an open enrollment. And I guess just to level set with everyone, open enrollment is the way in which employees elect and get coverage on benefit plans that you provide as the employer. So we'll talk a little bit about that, a little bit about the preparation up to open enrollment, and then how to conduct a successful open enrollment. We have some questions from some of our attendees that they submitted when they registered. We're definitely going to answer those. And then we'd love to answer any questions that come up during the discussion today. So if you have any of those questions, please feel free to put them in either the Q&A box, the chat box, or the chat box down below. You can see those in the toolbar down in Zoom. We have muted the audience, but that does not mean that we don't want to hear from you. That's just so that we don't get background noise that kind of interrupts the discussion. So please feel free to communicate with us in the Q&A or the chat boxes as we go. We'll try and answer those questions that you have or direct comment on any comments that you have throughout the presentation today, because we'd love this to be as interactive as possible so that you can get the most out of it. If we're unable to get to your question during the presentation, we will set aside time at the end to answer any questions that you've put in there. This webinar is being recorded. So if you registered for it, you will receive a recording of this webinar in your email. Give it about a day or two after the presentation, and then it will pop into your email. And then if you have any takeaways or any questions after the presentation, please feel free to reach out to us. Our contact information will be on the ending slide. So now that we've got the housekeeping rules all set down, let's talk open enrollment. So before we actually go through enrolling employees in benefits, I guess we got a shop for benefits, right? So Ellen, do you want to start us off on that, and how do employers shop for benefits? What advice would you give them when they're looking to do so?
Sure, that's a great question, Marcus. So I think the most important piece and step in the employee benefits process is finding a broker that you're comfortable with, someone that's knowledgeable in your industry or knows all of the different insurance carriers, knows the different options out there, and can actually tell you the why. There are so many different plan options available to you, so many different carriers. You really want somebody that understands the entire marketplace.
I agree, Ellen. I think one thing I would add to that is because insurance regulates at the state level instead of the federal level, it is important to have a broker who understands the differences from state to state. In many cases, since COVID, obviously, companies have become much more willing to hire remote, things like that we're seeing a major trend in. Another piece I would put in there is, to some extent, the years of experience too matters, and the different things that maybe that broker has seen. To your point that there are just so many products out there, you don't want somebody who's going to bring in only a small piece of the pie necessarily, but you don't want somebody that's going to bring in 500 options either. You want them to understand your business, and they should be asking you some questions as you make that decision. So somebody who really understands what your business is going to be able to more easily identify, okay, out of all of these options in the world, what's the most appropriate? So yeah, I think you're right. I think the broker decision really is the biggest first step. because again, for the most part, people get the same type of plans and quotes, regardless of the broker you work with in almost every scenario. There's few exceptions to that. So I think that's a pretty big first step.
So it sounds like it's almost you're going to want a broker who's you've got a consultative approach. You mentioned understands your business. And so I wonder if you could kind of elaborate on that a little bit, James, as like, we have all these different options. It sounds like there's a lot more to it than just, hey, get me the cheapest price on a medical plan.
Exactly. So just some of my experiences I've had is I've worked with people and built relationships over the years. It takes time to do that, obviously, and build that trust and confidence. But if you are just starting out and you're quote unquote interviewing brokers to decide who to work with, you may want to ask them some key questions of, what things about my business could potentially impact this? If I'm looking to grow in other states, are these plans going to be available? Just different things, again, proactively. It shouldn't be, what kind of plans do you have now? Okay, let me see if I could find you something cheaper. I think that's kind of a default setting for a lot of the industry, because the distribution channel that carriers have set up is through brokers in almost every state.
Mhm.
But if they understand that, they're going to be able to tell you, to give you an example, I've had a client who thought for sure going self-funded was going to save them money because they had heard people are saving money there. In that particular scenario, it would not have. I knew that. I explained that through, and it made sense by the end, right? So you want a broker who, again, understands where you're at in the segment within the insurance industry, what some future plans may be, to where you're not struggling halfway through the year with the plan you have that's no longer appropriate because of your growth plans or changes. And really who's going to try to put something in place that's compliant for you. Because the worst thing in the world is to find out, if you were supposed to be offering affordable coverage because of ACA rules and things like this, that you aren't, or if you weren't supposed to be offering a certain product, an HMO, to an out-of-state employee, and somehow you got them enrolled on it. Things like that create issues. So again, having a broker with some experience, absolutely is the first step.
And that's such a good point in regards to the compliance issue. The insurance industry changes, it seems like daily. There's new regulations coming out all the time. So having someone in your corner that understands that and is reading up on the new legislation and helps you stay compliant is also really important.
Yeah. And it's also, I think, benefits are, yes, it's highly regulated. You have to stay compliant. There are obligations, from an insurance standpoint, from an employer standpoint, that a broker can really help you with, back to understanding your business. One of the questions that I've heard employers ask, and I think they're good ones, is, what are other employers in my industry offering? How can I be competitive? In offering benefits, if my employees have come from a competitor, or if they're looking at a competitor, how do I know that what I'm offering is, something that's going to help me stand out as an employer? And I think brokers can probably help with that too, right?
Definitely.
Absolutely.
Yeah. So you definitely need to get some benchmarking. A lot of brokers have that data, not only because they have a variety of clients that they work with, so they can provide that anecdotal information, but we also have resources and tools that we can use to assist you with that as well.
Yeah. So aside from picking, the actual plans that you're going to offer, then I think probably the next step is deciding what type of an enrollment you're going to do, right? Is it going to be, we've heard of active enrollment and passive enrollment. Can someone help kind of distinguish what those things mean?
Yeah, I'm going to hop in. Alan, if you want to add to, I mean, it's a very industry specific term in a lot of ways, but really the core of the question, active or passive, just means, are my employees required to go in and make elections every single year? Passive is more of if you don't go in and make elections, you're just going to keep getting what you've elected the prior year. I don't think there's an easy answer for that. And unfortunately, a lot of things in insurance, that's the case. I think, again, that's where a broker helps educate on, what is best. Sometimes clients that I've worked with have so many things going on internally that, they really want a passive because they can't take people off of the line or whatever it is they're doing. And there's pros and cons to that. To me, that means you need to do more education available to those employees, because I think the biggest thing going passive that's a negative is the constant reminder and education to employees. The whole point of offering benefits and paying as much as companies do today to have those benefits to attract and retain key employees or good employees, I think gets lost when you start losing the fact that we're doing this for the employee and their family's benefit. So we want to make sure they know what they have. Ellen, your thoughts on the difference in preference?
Yeah, I completely agree with everything you said. Passive is always, that's the easy route because there's not as much to do. There's not as much strain on your staff and on the HR team to facilitate that. And I think it definitely is okay to have a passive enrollment. But every once in a while, you need to make it active. To James's point, it's the education. Employees leave a lot of times because of either pay or benefits. So you're having employees potentially leave. And we've seen this with our clients as well, leaving to go to other businesses and saying, hey, they offer me better benefits. And then you're looking at it and you're like, wait, we offer all of these benefits, but you just haven't been educating your employees and just staying with the status quo. And of course, we all know that it is much more expensive to hire a new employee than to retain your current employees. So that's definitely something to be aware of.
I think another aspect to keep in mind would just be sort of the turnover level of your actual employee base and also the turnover level of the benefit offerings themselves. Like if you're changing a lot in your benefits package from year to year, moving carriers, changing networks, changing plan designs, it may be a better idea to have an active enrollment because there's going to need to be like, an actual evaluation of the benefits if things are changing. Employees can't keep what they had previously. If you've had a fairly stable benefits platform in place for several years, like you've been with a certain carrier for a certain product for a while, that kind of a thing, you don't have a lot of turnover in your employee base. So most of your employees have been through an open enrollment once or twice with this same general slate of benefits. You might be able to get away with a passive enrollment a little bit more easily. And so it's kind of a case by case basis.
Yeah.
Yeah, it sounds like the active and passive are, what are the consequences to an employee if they don't go through open enrollment? And that's really the key difference. And also the opportunities there to educate employees on what their benefit offerings are. But, that's something that I think may get overlooked at times. Picking the plan, now let's do enrollment, but you really need to educate the employees and how, what materials do you need to prepare? How do you communicate to your staff about open enrollment? Is that something that a broker can help with? Jack, what do you think about that?
Yeah, sure. There's different ways employers can set it up. Some employers like to kind of manage that process more, but ultimately, like you're partnering with a broker because they're the subject matter experts. They live and breathe this every day. And that's very much a part of our job is to help you educate your employees and making sure they're getting the most out of their benefits and actually being able to utilize everything properly and make the correct decisions. As far as communication and materials, I think you can break it down into a couple different categories. The first one would probably just be more administrative stuff, organizational things. So first of all, communicating what is open enrollment, like you talked about off the top. What is the importance of it? The fact that it's sort of the one annual opportunity you have to make sure you're orienting your benefit decisions the way you want to. And outside of that window, unless you experience, a qualifying life event or some sort of major thing that would allow you to change things, you're going to be locked into those decisions for an entire year. So that's important. You need to let them know, when does it start? How long are they going to have to review and evaluate and ultimately make decisions? When are their elections due? What is the effective date for which those elections are actually going to go into place? Like when are they electing benefits for? So that'd be sort of like the administrative piece of it. So communications around those timelines, potentially putting, if you have a brick and mortar location with common areas, maybe putting some flyers in to kind of, in high traffic areas to make sure you're reminding employees and kind of keeping that top of mind. The second piece would be more sort of like the actual benefit detail, like education on the specific benefit offerings. What are the plans? What are the differences between them? What are the costs associated with them? How do they work? Those sorts of things. So really making sure employees are able to understand what's being offered to them in the first place, because if you don't understand it, you're not going to want it or you're not going to be able to use it effectively. And then the third piece would also just be, I think, additional education on resources that are available to employees so they can actually interact with their benefits on an ongoing basis throughout the year. Because open enrollment sometimes kind of gets viewed as sort of a siloed event. But there needs to be sort of a piece of the open enrollment that you kind of help employees, if there's a mobile app where they can go and kind of check their deductible progress, manage claims, get an ID card, provider finders to make sure they're staying in network, value added programs that carriers offer, like a wellness program, a weight loss program, a marketplace with discounts on, various products or whatever else. There's a lot of additional resources that are available to employees that are going to help them have a better plan experience and get the most out of, what they're paying for essentially. So those are sort of the three categories that I would break it down into. And then as far as the, whose job is it to educate it and what can that look like? I mean, that can take a couple different forms. Like I said, the employer can kind of manage that as a brokerage. We can do a live webinar, kind of like we're doing with this. So if your employees have that capability, we can go through and do a live presentation, walk through all the benefits, have employees ask questions live. We can do pre-recorded presentations that you can distribute to employees on the back end so they can watch it on their own time. If you're, the kind of employer that's maybe going to have issues getting all of your employees in the same place at the same time for a benefits presentation. And we can also come on site and interact with your employees, directly if that's a better solution for you as well.
Yeah, so the three types of things you want to communicate or educate on it's the process itself, the open enrollment process. How do I enroll? What are the dates of enrollment? The actual benefits themselves. And there I agree with you. Getting granular, I think is a benefit or is helpful for employees. I think if you've been working with benefits for a while, you just kind of intuitively kind of understand what a deductible is or what a copay is. But if employees don't use benefits that often, or if they're relatively new to having benefits, or if they had been on a spouse's benefit plan and this is the first time they're going through it, those things can be very confusing. I think are just in general benefits are confusing as hell until you really develop like a competency of understanding what is going on. And then ongoing resources, like after you make your decision, how do you actually get the most out of what you're paying for? I think that's a good way to break that down. And something else I've thought about in the past, Jack, is if you talked about like doing a live presentation or a recorded webinar or on-site or flyers, like may want to think about a variety of approaches. Something I've heard in the past working with clients is that we can provide resources, but sometimes you may be talking to the spouse that has the responsibility of providing benefits to the family, but they don't have the benefit literacy that the other spouse has. And so providing resources like a live event is great, but providing a resource that they can use to take home and talk to a spouse, helps them all the more understand what they're getting.
Absolutely. We make benefit guidebooks available to our employer partners through every open enrollment. And that's going to have, once again, information on all of the plans, detailed plan summary documents, provider finder information, side-by-side plan comparisons, cost information, all kinds of things and additional resources. And then also contact information for me as it pertains to our business specifically about the resources internally here that we can help, educate employees and field questions as that goes through the actual process.
Yeah, so there's a push of information at open enrollment, but is that the only time that you educate about benefits, James?
No, I would say absolutely not. Again, I take this as really a two-part, right? It is for the benefit of the employees and the families. I'm an employee, I've got a family. I want it communicated to me in a way that I'm going to be able to understand, be able to provide it to my spouse, all of those things. But it's also an employer decision in terms of the financial aspects, right? Every employer I've ever talked to wants to provide the best benefits they can, but there's that balancing act with the rising cost of healthcare of, well, what does that mean, right? I'm not going to pay $3,000 a month for an employee-only coverage just to have a zero deductible, no copay plan. Those don't exist because nobody would pay for them. But on that employee level piece, again, I could speak to a few things I've done historically, we do here. It really is a partnership with that business owner to engage at the level that they want to. But my preference, my recommendation is always a minimum of a quarterly reminder of some sort to your staff, even if it's only a little slight product highlight. By the way, and the key part is not the product highlight so much as, by the way, here's your contact. To Jack's point, when you put these things together, when I was in my 30s, I had no need to really understand how they worked. I did because I'm in the industry, But before I was, let's say, just out of college, just going off of my own benefits, I couldn't tell you how a deductible and copay worked. And I think to your point earlier, Marcus, is it takes a lot of education. And because it's not something that hopefully people have to use all the time, you forget, right? You could do the best presentation possible in open enrollment. 3 months later, you've forgotten, if you're not somebody dealing with, unfortunately, chronic condition, or somebody who's really engaged because you're in the industry or you have to utilize a lot, which is the vast majority of us who are not in one of those two things, right? So I do highly recommend that partnership as part of that vetting process with the broker of, well, how am I going to keep my employees engaged? And there's a selfish piece of that too, right? So when I mentioned the employee part, that's the let's do good for people portion. But the employer part, the financial aspect, if you help advise and coach employees what's available and how to properly use it, you have the opportunity to mitigate some of your claims costs, which helps all of us when it comes to the rising cost of healthcare. And you'll see a lot of the carriers out in the marketplace have gotten very involved in this too, that 10 years ago, they didn't. They might have had a nurse line, but they didn't promote it, right? Now you can't talk to an insurance carrier who's not talking about the new mental health EAP they're rolling out, the two-tiered structure to where you can get cheaper care if you do it this way versus that way. Now the Transparency Act and some of the things coming up that is requiring our health carriers and our providers to tell us what the cost is, right? It's oddly one of those few products you could ever purchase that you don't know what the cost is until after you're done utilizing. So again, there's a huge push within in the industry to provide education. So in terms of educating employees, I think it's a continuous process.
Yeah, there's a lot of good stuff there that you mentioned, James. The one thing that really stuck with me was you said when I was 30s or when I was in my 30s. So you are not in your 30s anymore.
That is correct.
But you also mentioned a Transparency Act about the cost of services, and is that something that's going to be taking effect? Because I know now, if you have a high deductible plan, you'd like to go shopping around to see what providers charge, but that's often very hard to do.
Yeah, so there's been some regulations that have passed. A lot of that's already started to be implemented. I believe January 1st, 2024, it should be essentially fully rolled out in terms of you have to, as a carrier, as a provider, actually show people what the cost is. If I go to Dr. A versus Dr. B, there's often a difference. And I don't know that 15 years ago, people understood that the contracts negotiated by insurance carrier and provider are not all the same. I'll even give you an example. Personally, we've had a scenario in the family where an MRI was needed. And today, because a lot of that is in place, I was able to see a place that charged $450 for the MRI. I'm on a high deductible plan, so I don't have copays for that. In another facility, literally, I think it was 2.4 miles away, it was charging $700. Now, there could be some differences in the equipment or something else, although from my experience, I don't know how much that matters. I'm not a provider or a radiologist or anybody else that reads that. But again, that is a big missing ingredient. And I think not only having the ability to see that data, but to ensure everybody understands, look, at this was pushed as regulation for a reason. This is meant to drive costs down in your healthcare premiums. So we need people engaged to shop, just like you would for anything else you purchase.
Right. Yeah, hard to be a consumer if you don't know what you're buying, the cost of what you're buying.
Yeah, for sure.
So back to open enrollment. We talked about making these elections. I've seen it done both ways, done on paper where you actually check or you write down what you want to enroll in. And I've seen it done electronically. Jack, is one better than the other?
I would certainly say that I think that electronic election capture is superior to paper. That's not to say that there aren't certain situations in which paper may be necessary depending on your employee population, whether or not they're particularly tech savvy, or if they have access to devices that would allow them to be able to make elections online and be able to understand the navigation process of that. But for situations in which that is possible, I think electronic enrollments are far superior. First of all, just the accuracy. You're not worried about misreading someone's handwriting when it comes to an address or a birthday or something along those lines. It's all typed in. It's very legible. It's much easier to get through it. It's administratively easier because it's all being captured in the same place. You're not hunting down forms from different people. Also, when you're doing an electronic process, you can sort of manage the process of them electing in terms of you can't progress past this point unless you provide certain information. And, unfortunately, sometimes if you hand somebody an application, they'll skip a field, or they'll be like, oh, I don't know that. And they'll just kind of go through it. And then you're having to follow up with employees more on the back end after they've completed open enrollment to actually get their elections processed. And, one of the most important parts of open enrollment is getting elections processed accurately and quickly so that everyone has access to the benefits they've elected on the effective date that they're supposed to have them. So for me, I would push electronic when and wherever possible, personally.
Yeah, and that makes a lot of sense because in open enrollment, really, if we zoom out, we're collecting a lot of information. If we're going to offer, 10 different plans, right? We can offer a couple different varieties of medical, dental, vision, et cetera, et cetera. There could be a high and a low, or 3 options in each. So there's a lot of different nuances there. We got to gather all that information, and that information needs to go a couple different places. It needs to go to the carriers. Hey, this person is going to be on your plan, and here's what they've selected. But then that information has to go to your payroll processor too, to make sure that when the employee says, because the benefits can be employer paid, employee paid, or a combination, employer and employee paid. So employees typically, vast majority of the time, are going to pay through payroll deductions. So we got to gather all that information so that we can correctly issue paychecks and correctly pay for their benefits. So yeah, having that in an electronic system, especially with feeds, file feeds to carriers, to payroll processor, it just makes a lot of sense, and yeah, eliminates the fat finger mistakes.
Yep.
Yeah.
Mhm.
I guess up until this point, we've been talking about benefits as, shopping for them, understanding what, is going to be compliant, what fits for your employee population. Are there any benefits that you just have to offer?
Yeah, so, yeah. If you are an employer that has 50 or more employees, there are some benefits that you are required to offer. Medical being one, and they have to be affordable benefits. So there are different rules related to that. There is a law coming out in place in Illinois right now, and that's in other states, that 401k is now a mandate. So if you have 5 or more employees, you're going to have to offer 401k benefits. So some of those.
If I can add to that too, again, back to the broker, right? You want to make sure that they're giving the right advice. Even to the point of what happened years ago now at this point with ACA mandating that large employers offer benefits. Even that is kind of a gray area, right? Because it doesn't mean you have to. It means you might be subject to a penalty though if you don't, which isn't quite the same thing as it's mandated and you have to do it. But the way our structure is here in the US, at least, is it's been for decades an employer-based distribution to the population. In most cases, yes, there's individual plans, there's Medicare, there's other things. But that again is just a good area where a knowledgeable broker with some good experience is going to be able to tell you that, ooh, you just hit a new threshold and here's what that means to you, right? You have to now do this reporting, or the product that I think is best for you, here's the reasons why. But there might be some additional caveats with level funded that you now are subject to, or self-insured. So ultimately, as an employer, it is your responsibility. That's why it's pretty important that you get with somebody who understands those regulations as you are today and as you might look like in 2 or 3 years. For me, it's really more, we need to solve immediately for right now, but we need to have some kind of a 3 to 5 year plan, just like you do for every other aspect of your business.
Yeah. Yeah. On the flip side, aside from the benefits that you have to offer or that you're subject to penalties if you don't offer, are there any benefits that are new and innovative? And this is something that we heard from some of our registrants, like what's the new thing in benefits? What are the new trends?
Yeah, so I'm not sure how much I would say it's brand new products necessarily. One of the things, if you read some of the industry journals, anecdotally, it is what we are seeing as well, just from our clients and even prospective clients, what they're looking for. One of the talked about rising trend products, so to speak, are your voluntary supplemental products. A lot of people are familiar with these just because of the Aflac marketing campaigns, things like that. But almost every carrier now offers them. It's not just unique to, it was primarily 2 to 3 companies 15, 20 years ago. Now you can go to Blue Cross and United and Guardian and MetLife, and they all have these types of products. And there's a reason they're investing in them, is because they're seeing the need for the population. So that's why you're seeing it happen more often. But there's definitely a rise in enrollment there. The second one that I would say is becoming a hotter topic, and this might be kind of early in the trend, but we've heard about it for a couple of years now, more senior care based. And when I say that, it's not Medicare. That obviously is a government program. Brokers really have little to do with it unless you're buying a supplement. But when I say senior based, it's things like almost like an EAP in terms of, hey, my mom's finally hit the point that I need to find a facility for her, or I'm doing some of the setting up trusts or wills or things like this. And there are products that are niche market products that have been around for a decade or less for the most part, but they're gaining popularity, even to the point of some states now are requiring long-term care policies be purchased, on top of some other mandates, to where, again, that's not necessarily something you wait until 65 to purchase, but the intent of the product is to deliver for those later in life cares, not that sometimes they don't apply sooner. So that's really what I see as the second quote unquote hot trend. The third, if there is one, is directly related to the affordability of healthcare, both for employers and employees. And that's really the insurance carriers and others. It's not even just in the carrier space, looking at more level funded, self-funded products, because one of the benefits you get with those type of products is it strips out some of the fees. Obviously, it could reduce your administrative cost. That's all part of that development of your premium. The one thing I don't know if I should say caution, but I will caution is, although this is a growing trend, and we've seen it to where only companies with 5,000 employees used to do it 30 years ago. And then it got smaller, and then it got smaller. We're seeing it now where companies are doing level funded down to 10 employees, 20 employees, because there's not that risk of having to pay out some large claim. But to go fully self-funded, I don't know the numbers have changed to where it's appropriate if you're less than, you can argue 250 to 500, somewhere in that range. But again, I've seen more attention paid and more product rolling into the market with those. The only caution is it's not appropriate for everybody. So again, working with a broker who understands when it's appropriate, when it's not, is pretty important. But those are the trends that I'm seeing right now.
And when you say the first one was voluntary supplemental, like an Aflac product, are those are like critical illness or accident insurance or hospitalization policies, like where
Exactly.
is that where you get cash if something happen? Okay.
Yeah, so they're in the industry, they're called indemnity products typically, because they have a structure of payout of exactly like a cancer policy. If you're diagnosed with cancer, you get X amount of dollars, and depending on its severity and treatments, you get additional dollars based on something happening. But yeah, again, we've just seen a tremendous amount of attention being paid to those products at this point.
Yeah, the distinction being the benefit doesn't just pay for the service or pay a portion of the service. The benefit is you get cash that you can use to pay for the service. You can use to supplement living costs or lack of income or whatever in the event that like these catastrophic things happen.
Exactly.
And I think as deductibles and out-of-pocket maximums and medical premium and medical plans rise, these plans are becoming more popular because it's kind of helping you offset some of those costs.
Yeah.
Yep.
Yeah. Those senior products that you mentioned, James, are really interesting because, you know, the costs at like when you're nearing end of life or when you need more care can really escalate. Also puts a big burden on your family, as I'm sure we can all, you know, have experiences with that or examples of that just in our own families. And, you know, when someone is aging, that there's a lot that goes into that. So having a benefit that can help or help make that easier, help you coordinate care, I can definitely see the value of that.
Absolutely.
One thing that I've talked with some clients about is the renewal date, and having benefits renew on January 1st. I think people are generally familiar with that. I think when things, you know, just a new year, I think that's intuitive for benefits to start then. Is there an advantage to having a January 1st renewal date, or do you have to have a January 1st renewal date, or can you do one that's in the middle of the year sometimes? Jack, do you want to take that, or Ellen, do you want to take that? Go ahead.
I can jump in. Yeah, I mean, I think it's definitely intuitive to want to have it line up with a calendar year. I think it's cleaner and it definitely is easier to understand. But also that's, once again, part of the role of a broker potentially is to help explain that to your employees. If you aren't going to go on that kind of a setup, and there are advantages to not going on a calendar year setup. There are a lot of companies, a lot of employers that do have their renewals kind of back-ended towards the end of the calendar year, whether it's December or January 1st, those sorts of things. And when there's a higher volume of renewals that need to be processed, of quotes that need to go out, of all kinds of service needs, that can really slow down turnaround times from the insurance carriers that we're working with. So sometimes having those renewals actually off of a calendar year cycle, when it's not quite as busy on the carrier side of things, can help you get answers quicker, get things processed quicker, and ultimately provide a smoother process for your employees.
The biggest issue that I see with our clients that renew January 1st, for example, you know, I think speaking with our carriers, something like 70% of health plans renew fourth quarter. That's a huge number. So the carriers are inundated, your broker's probably inundated. And then you have holidays, people taking vacations. So how do you get your employees to do their enrollment? All these different factors play into that. The biggest one is the ID cards, especially if you're switching plans and doing an active enrollment. You know, your employees will likely not have their ID cards by January 1st. You got to start way ahead of the game. So just keeping that in mind, a lot of times it is beneficial to kind of have that have your renewal off of fourth quarter. You just have more access to the carriers and things just run smoother and quicker.
Yeah.
And go ahead, James.
I was just going to say to that point, Ellen, I mean, even for a lot of employers I've worked with over the decades, their busiest time tends to be fourth quarter, year-end closeout, all the things that typical business cycle. So there's often appreciation to have that outside of that busy time between holidays, business cycle, all those things. In a lot of ways, I think I view it more as just a mental block in some sense, that we're so trained that it should line up with how the plan functions in terms of the deductible and out-of-pocket reset. But over the years, I think essentially all carriers at this point, I can't remember the last time I had a carrier say they wouldn't honor deductible credit or potentially even out-of-pocket credit if you move from Aetna to United or Blue Cross to Cigna or whoever it is. Mm-hmm. So again, they've addressed that by taking away any loss you would have by moving outside of a 1-1. But yeah, I mean, everybody has their own scenario. I'm not sure one is greater than the other. I think we've pointed out some of the advantages of this over that, but that doesn't apply to every scenario. So again, right back to that consultative approach of, is it best for you or does it not really have an impact?
And I also, sorry, Marcus, I also wanted to add, you know, regardless of when your renewal is or when your open enrollment, you know, you just have to make sure you're planning early and, you know, making sure you have enough time for your employees to enroll. You need to give them at least 2 to 3 weeks. You want to make sure that you close it early enough that the carrier has enough time to process the enrollments and generate the ID cards. So just making sure that you stick to those timelines and start early. That's really important as well.
Yeah, how long should an open enrollment last? You said 2 to 3 weeks. Is that what you'd recommend?
Yeah, 2 to 3 weeks on average. You also, again, have to consider if it's passive or active. Just give them enough time to make a decision. Again, you know your employee base much better than we do. So if all of your employees are married and they need to go and talk to their spouse to make a decision, they might need a little bit more time versus having a full population of all single males who just will pick the one plan real quick that they see and then move along. So just kind of understanding your employees and what their needs are will kind of gauge how long your open enrollment should be. But typically it'll be 2 to 3 weeks, depending.
Awesome. Well, that was going to be my question, Ellen. How long should open enrollment last? And yeah, and end of year 2, not only do you have the carriers, but the holidays, the holiday season. So that can be a little hectic, but yeah, those actually, those are all the questions that we got from our registrants. And so if I guess at this time I'll open it up, not in the sense of I'm not going to unmute mics, but if anyone on has questions they want to submit, please submit those now. We'd love to discuss them. While we give you time to do that, Jack, Ellen, or James, are there any other thoughts that you wanted to share that we didn't cover today? Kind of a wide-ranging discussion. I think we covered most things.
We covered a lot. I'll dovetail on just a little bit of that last question, because I think of that as a 2-part, really. One is, when should the broker be delivering options to decision makers at a company so they have time to deal with what they need to, because you can't get your renewal or alternate options and make a decision the same day. And to me, that typically means your broker's delivering that 60 days in advance at a minimum. Now, with that, depending on group size, sometimes carriers release renewals at different times to where occasionally it will fall a little bit after that. But what I've seen, at least in the industry, sometimes become a bad practice of delivering late in maybe because of overwhelmed capacity, maybe because of intentional wanting to limit the time you have to shop and look at things. Again, going back to just making sure you're partnering with a broker you know and trust is doing what's in your best interest. And the vast majority of people out there, just like any industry, are those people. But you should have a full understanding of what that timeline looks like before you even start, just through conversation with your broker, because again, there are variables based on your own scenario that could change that answer I gave back or forwards one way or the other. But making sure you feel comfortable that you understand the timeline, that's a pretty key component to me.
Yeah. Jack, did you want to jump in?
I was just going to kind of actually dovetail on the same kind of topic in terms of like timelines and stuff. I was just going to add that, it's a combination of, wanting to provide your employees enough time to actually evaluate and make the correct decisions, but not providing so much time that it isn't top of mind and there's really no incentive to review the material. So it's trying to find that balance in terms of timelines to make sure people are actually engaging with the material and doing what they need to do, and also have enough time to make the correct decisions.
Yeah.
I agree with that, Jack, because we always have, anytime we host an open enrollment, you always have the people that are enrolling the first or second day, and then it's crickets until the very last day of open enrollment, and then those stragglers finish up. Then you always have that one that's like, enrollment closed, I still need to make my election. So yeah, again, you don't want to give them too much time, but enough time that they can make a thoughtful decision.
Yeah.
Well, thanks everyone. I don't see any questions, so we can wrap up. I think, for me, just listening to the discussion, there's a lot of stuff that goes on with open enrollment, from selecting the plan to figuring out which plan works best for you, budgeting for that, educating your employees, actually getting your employees to enroll. And so it's not as easy as simply, going shopping for benefits. this is a huge spend for employers. And so I think you want to be comfortable with the person that you're working with. You want to be able to trust the broker that you're working with, that they're giving you the right advice, that they're, you know, working side by side with you so that you get the biggest bang for your buck. Ultimately, it's, you know, taking care of your employees and making your workplace a great place to work. So yeah, there's a lot of things to consider here. So having a good partner is really essential to the process. So thank you all for attending. Thanks, Jack, Ellen, James. Attendees, if you have any questions that you didn't get a chance to ask, or if you think of something right afterwards, which seems to always happen to me, my email is right there. Please don't hesitate to send me an email. I will be happy to either answer it or get in touch with our team here so that we can get you the best response possible. But thank you all for joining, and we will do another one of these Ask the HR Experts next month. Thank
Thanks,
you.
Marcus.
Bye.